So in this particular video, we are going to look at the extraocular muscles, which means external muscles of the eye. So extraocular muscles and their innervation. So we have a total of 6 to 7 extraocular muscles, and we shall name them together here. So the first one, I'll start with the easier ones. So let's say this is your nozzle part. I believe you remember what nozzle means. Nozzle is the side of your eye which is near the nose. Then temporal is the side which is near your temporal bone. So if we talk about the nozzle, we have this muscle here. It's called the medial rectus. So this is medial rectus. Right? Medial rectus. So that's called the medial rectus, which means that the muscle on our temporal side to obviously be called the lateral rectus. So I can just duplicate this. Lateral rectus. So this will be called the lateral rectus. Lateral rectus. And then we have one which is up and down. So this will be called superior rectus. This will be called inferior rectus. So that's superior rectus. And then the one below is called the inferior rectus. So the one below is called the inferior rectus. As simple as that. So this is called the inferior rectus. Then we can see these as other two muscles that are moving sideways. So these are called oblique muscles. So this will be called the superior oblique muscle. Superior oblique muscle. And this will be called the inferior oblique muscle. Or someone can call this the superior oblique, and then this just the inferior oblique. Or they can call them the superior rectus, that one makes sense, because that definition I used just to refer to like my easier members. But let's take superior oblique and inferior oblique. So we have a total of 6. Just to recap, we have the lateral rectus, have the medial rectus, have the inferior rectus, superior rectus, superior oblique, and inferior oblique. So we shall go ahead and look at their innervation. So how they are innervated. So their innervation, I will try to erase some of these things we may not need that may distract us. So the oculomotor is the main man here to supply most of the muscles, most of the extraocular muscles, except 2 muscles. So the easiest way is to remember the exceptions. Then the rest will be easy for you. So the exceptions are lateral rectus and the superior oblique muscles. So this superior oblique will be supplied by the trochlear nerve, which is also known as cranial nerve 4. So superior oblique will be supplied by the trochlear, which is also known as cranial nerve 4. Whereas the lateral rectus will be supplied by the abducens nerve, which is also known as cranial nerve 6. So having understood the supply, it means that the rest of the muscles will be supplied by the oculomotor, which supplies a total of 6 muscles. So where are the 6 coming from? We have seen that here there are 4 remaining muscles which will be supplied by the oculomotor. However, we also have some 2 other muscles, that is the levator palpi. I don't know if I pronounce it right, but it's responsible for opening your eye, like lifting this part of the eye, keeping it open. Meaning without innervation of this muscle, you have your eyes closed. So that's the levator palpi. Then the other one is the pupillary sphincter muscle. Pupillary sphincter muscle. And this is its parasympathetic division that supplies that, as we are going to see very soon. The parasympathetic division of the oculomotor supplies the sphincter palpi. What is it responsible for? We are looking at sphincter of the pupil, which means it's responsible for regulating the size of the pupil. So that's the nerve supply. Shall we look at their actions? Of course. So the actions, the easiest way, I'll first erase some of this information so that we have a clear view of it. So in this part, we are going to look at the actions of these muscles in the easiest way possible. So starting with the easier ones, we have the medial rectus and the lateral rectus. So the medial rectus, for it will just move the eye medially. You get? It will move the eye medially, like that. Whereas the lateral rectus will move the eye laterally, like that. You get the point? So it will just move the eye laterally. So this is medial movement of the eye, whereas the lateral rectus for lateral movement of the eye. How about the superior rectus? To move the eye upwards, whereas the inferior to move the eye downwards. The exceptions would be in the obliques. The obliques will perform contralateral actions, in that instead of the superior oblique elevating, it will just depress the eye. That's moving the eye downwards. Whereas the inferior oblique will move the eye upward. So contraction of the inferior oblique will move the eye upward, whereas contraction of the superior oblique will move the eye downward. So there are other supplementary actions of these muscles. So talking about the additional actions, we have what we call intorsion and extorsion. So what are these actions? Intorsion and extorsion. So intorsion, in simpler terms, is how your eye can move medially from up downwards like that. That's intorsion. Then extorsion is when it moves laterally, like outwards, like that. You get the movement. That's extorsion. Then the other action we've talked about is moving the eye inwards or medially. That's adduction. Whereas moving it laterally or outwards is what we call abduction. So what I need you to remember is that both superior muscles, that is the superior rectus and the superior oblique, will perform intorsion. These will perform intorsion, whereas the inferior muscles will perform extorsion. You get? Then the other one is a supplement, in that the obliques will perform abduction. Both obliques, superior oblique and the inferior oblique, will perform what we call abduction. Abduction, moving the eye laterally. Abduction. Whereas the superior and inferior rectus will perform adduction. As simple as that. Adduction. So once again, the medial rectus, adduction, the lateral rectus, abduction, the superior rectus, elevation, inferior rectus, depression. Then you go to the secondary functions. Both superior muscles intort the eye. Both inferior muscles, they do what? Extort the eye. When you look at the obliques, they abduct the eye, whereas the superior and inferior rectus, they adduct the eye. So those are the functions of the muscles. So in addition, I talked about the levator, part B. So this one is supposed to elevate this covering of the eye. So meaning in case of loss of innervation to this muscle, we shall have our eyelid closing the eye, which condition is known as ptosis. You come across it, ptosis. Then the sphincter pupillae is responsible for dilating the eye. Sorry. It's contracts to reduce the aperture of the pupil. So in case of loss to this sphincter pupillae, we shall have extreme dilation of the pupil. Extreme dilation of the pupil. As an assignment, I'll give you is to look for that term by which the pupil dilates, or I'll give it under the disorders.